All right. So to kind of pick up where I left off, we were on burns. They have your partial thickness burns, full thickness burns. So determining the severity of burns, consider the following factors: agent or source of the burn, body regions burned, the depth of the burn, extent of the burn, the age of your patient, other illnesses and injuries. Rule of nines helps estimate the extent of a burn area. Adult body is divided into 11 main areas. Each represents 9% of the body's surface. So here's a good picture with the rule of nines. And then a child. And infant. Determining the severity, rule of palms. This can help estimate the extent of burn area as well. Palm and fingers equal about 1% of body surface area, easier to apply to smaller or localized burns. And remember, this is the patient's palm. Must be classified to determine order and type of care, priority for transport, maximum information to provide to the emergency department. So that's severity of the burns. Pediatric notes: infants and children have a much greater relationship of body surface area to total body size, resulting in a greater fluid and heat loss from burned skin. Patient care for thermal burns: stop burning process and cool the burned area. Ensure open airway and assess breathing. Look for signs of airway injury. Complete primary assessment. Treat for shock. Remember with that potential for airway burns that you're looking at patients that are at severe risk for loss of airway. And not only that, swelling in the airway, which can complicate how you're going to manage that airway as well. So you really want to be thinking ALS support or rapid transport for any patients if you suspect there could be any burns or damage to the airway, even if they are currently having adequate breathing. Evaluate burns by depth, extent, and severity. Do not clear debris. Remove clothing and jewelry. Wrap with dry, sterile dressing. For burns to hand or feet, remove patient's rings or jewelry and separate fingers or toes with sterile gauze pads. Really, you don't want anything on the patient that can constrict if swelling starts to occur. Patient care for chemical burns: wash away chemical with copious amounts of flowing water. If dry chemical, remove contaminated clothing, then flush with water. Apply sterile dressings, treat for shock, and transport. Radiation burns: exposure to high levels of radiation can harm the human body both immediately and in a delayed fashion. A great number of sources of radiation. Difficult to detect without specific monitoring equipment. These are extremely harmful. Do not approach a radiological injury without protective equipment and specialized training. See patient with a radiological burn only after they have been decontaminated. Most will present like thermal injuries. So this is going to be where you're going to need your outside resources, your hazmat team, etc. Electrical injuries: severe damage through body along path of electrical current. Entry and exit burns are possible. Respiratory/cardiac arrest are possible as well. Bones may fracture from violent muscle contractions. Provide airway and breathing care. Provide basic cardiac life support. Be ready to defibrillate. Care for shock and administer high concentration oxygen.
Salem Dispatch 8409.
Care for spinal and head injuries as well as extremity fractures. Evaluate the burn sites. Cool burning areas and smoldering clothing the same you would for a flame burn. Apply sterile dressings. Transport as soon as possible. Dressing. Any material applied to wound to control bleeding and prevent contamination. Bandage is any material used to hold dressing in place. So this is your dressing. And then a bandage would be something like your Coban. Universal dressing, available for profuse bleeding, large wounds. Pressure dressings, used to control bleeding. Occlusive dressings, used to form an airtight seal. Wounds to the abdomen, large neck veins, open wounds to the chest. So this is cling bandage, holding the dressing in place. Dressing open wounds, always take standard precautions. Expose the wound. Use sterile or very clean materials. Cover the entire wound. Control bleeding by direct pressure and or hemostatic agents or dressings to stop or slow the bleeding. Do not remove dressings. Do not bandage too tightly or too loosely. Do not leave loose ends. Do not cover tips of fingers or toes. Must be able to observe distal skin color changes. Cover all edges of the dressings. So this person's utilizing overlapping wraps and then keeping it snug. Like I said before, we'll be going over these questions in class. And that's it for this chapter. So I will see you guys Thursday. I'll try to get these lectures posted on Canvas soon. Really sorry for if you guys hear any of the outside noise, rig noise, radio, anything like that. But definitely want to get these full lectures recorded for you all and still be able to do in-person skills. So we will make it work. As always, feel free to call or email any questions you might have on the chapter or any issues you might be dealing with class. You guys are awesome, and have a good day. Bye, guys.